Hello, my name is Ava Berger, and I will be presenting on the default mode network in the posterior cingulate cortex for Dr. Brian Metcalf's psychobiology course. The default mode network is a system of brain components that are active during periods of unfocused thought. The DMN is associated with states of daydreaming, focus on one's internal states, autobiographical memory, and hypotheticals such as imagining the future. Also characteristic of the DMN is socio-emotional processing, as in exercising a theory of mind. Activity of the executive control network, which is active during externally directed tasks, suppresses the DMN activity, and vice versa. Researchers Rakely et al. In 2001 utilized a reversal of the cognitive subtraction procedure to see which regions the executive control network deactivated. The medial prefrontal cortex and the posterior cingulate cortex are active during states of rest. This unfocused activity level is 90% that of directed thought, which contradicts the prevailing conception and has since enabled a relatively unconscious-centric viewpoint. The DMN is composed of the posterior cingulate cortex, the medial prefrontal cortex, precuneus, and lateral parietal cortex regions, although it involves many networks. The posterior cingulate cortex, or PCC, corresponds with a sense of self-identity, is active when thinking of self or others, past, future, spatial feature processing, attentional states, and involuntary awareness. The close cousin, precuneus, specializes in how to use the past to navigate the future, as well as some subjective pain processing. The dorsomedial prefrontal cortex is hypothesized to analyze social behavior, infer mental states, and other high-level abstractions. The medial temporal lobe connects to the DMN through the parahippocampal gyrus, so is key for memory functions. At the temporoparietal junction, information is integrated from the limbic system, thalamus, and various sensory regions, playing a key role in cognitive empathy and prosocial behaviors. Here is a textbook figure. The distributed DMN is further noted to play a hypothesized role in the preparation and direction of conscious thought, which makes sense as it constitutes a great portion of the whole brain. Before the age of 9, there's a distinct lack of anterior to posterior connection, while during adolescence there's this surge in default mode network development, corresponding to the emergence of abstract reasoning, a sense of identity, empathy, and general cognitive performance. Similar brain circuits are activated by both daydreaming and dreaming states. During waking and REM sleep, the medial prefrontal cortex and more posterior sections are linked, while during non-REM sleep, they decouple, possibly leading to the relative unconsciousness of deep sleep. REM subsystem connectivity offers a paradigm through which to view the memory consolidation of sleep. Insomniacs demonstrate a markedly elevated activation of certain DMN connections compared to controls during a self-referential task. As determined from meta-analysis of many resting state neuroimaging studies, disruption in DMN activity may result in autism spectrum disorder, ADHD, bipolar disorder, neurodegenerative disorders, schizophrenia, anxiety, and major depression. And I would note that in ADHD, the executive control network and the default mode network synchronization are disrupted, which makes sense because those individuals often have difficulty switching between tasks or during transitions. A hallmark of major depressive disorder is uncontrollable self-rumination and focus on the negative mood. It is also closely correlated with increased DMN activity. The posterior cingulate cortex shows higher connectivity with the lateral orbital frontal cortex in such patients. And I think it's very clear from the symptoms of depression that the executive control network is weakened and less active, while the DMN, which is associated with thoughts of the self and rumination, is more highly connected and isolated. The DMN may also offer a model to comprehend addictions, as it is hyperactive in the withdrawal state, reflecting obsessional focus on short-term discomfort to the self rather than higher executive function goals. It has been established that the DMN salience network, or attentional resource allocation network, and the ECN, or executive control network coupling and connectivity, is disrupted in the pathology of substance use disorders. This is possibly due to increased and isolated default mode network connectivity and the decreased SN and ECN activity. And clearly you can see from this little diagram that this displays the variance between the two patients. Now there are solutions. Most notable and most effective is meditation, since it focuses on keeping the mind from wandering, refocusing the brain, and dampens the DMN activity. Getting into a flow state, in addition, as an athlete or a musician, is also associated with increased ECN and decreased DMN activity, which makes sense as people report a sense of losing one's ego. Experienced meditators, according to this clip, actually show a decrease in DMN activity, which is lasting. In addition, psychedelics seem to disrupt the excessive self-preoccupation seen in disorders of addiction and depression. Neuroimaging studies show that psilocybin, which is the ingredient in magic mushrooms, and LSD reduce the DMN connectivity, correlating with a sense of ego dissolution. Psilocybin also caused a decrease in the positive coupling between the medial prefrontal cortex and the posterior cingulate cortex. The PCC metabolism is in its regular state 20% higher than most other brain regions, which is a phenomenon counteracted by decreased blood flow during psilocybin administration. The high activity leads some to speculate the PCC role in consciousness, high-level constructs such as the self, and such concepts as the ego. Sustained interruptions in PFC and PCC connections have also been proven in psychedelic treatment. Interestingly, intraoperative electrical stimulation of the posterior cingulate cortex in one conscious patient resulted in a transient dreamlike state with vivid visual imagery, which was conducted by Hebert et al. In 2014. These states and affected circuitry closely mirror psilocybin research, again validating the importance of this region in consciousness. This is a simplified picture of a very mysterious system of distributed processing, which it is fun to liken to the Jungian or Yang, dark side, feminine, chaotic, unconscious, which gives birth to and supports consciousness. Thanks for listening. My sources are posted below. I highly recommend checking them out.